Assalamu alaikum. We are starting with the clinical case. We have Mrs. Emma Graham. She came after 2 weeks vacation in Egypt with a history of intractable diarrhea. Despite conservative management, she's still worsening, opening her bowels up to 5 times per day. She's now complaining non-specific abdominal pain with a high body temperature, 37.9. Culture sent, also radiograph and abdomen done. Patient non-smoker and no past medical history, or she has past medical history of gallstone disease only. You will sit with Mrs. Emma, take history and do examination. We will start in seconds. You ready, Dr. Abdullah?
Yes.
Yeah, let's do it.
Yes.
Here you go.
Hello there.
Hello.
I'm Dr. Ahmed, doctor in medical clinic. Today, am I talking? Can you confirm your name and age, please?
My name is Emma Graham. I'm 25 years old.
25?
Yes.
Yes. Okay. Nice to meet you, Mrs. Emma.
Nice to meet you.
Yeah. Today, we are here to discuss some issues related to your health condition. I have been asked to examine you and to address your concern. Is that okay with you?
Yes, please.
Yeah. To my knowledge, that you are trouble with some loose motions for the last 2 weeks, and it's now around 5 times per day. You need to open your mouth, and also you have raising in your body temperature. Okay, can you tell me more about these loose motions? When
Yes,
did this start?
so it started. I went to after finishing my university, so I went to celebrate that we finished, me and my friends, in Egypt. So we went in vacation in Egypt, and after at the end of my holiday, on the last day, I started to develop loose motion, abdominal pain. Okay. And then and then I came back. I went to the GP. Still, my loose motion didn't subside. So he did for me some tests, and he requested a scan for me. So I don't know what's happening, and I don't know what is the result of the test.
I'm sorry for that. And how do you feel now?
I'm still having this diarrhea, doctor.
Okay, okay. Be sure we are here to support you to give you the proper treatment. Okay.
Okay.
Okay. And Mrs. Is it the first time that you have this diarrhea, or you have it before?
No, I have it. I have one attack of diarrhea in my exams, but this subsided. I was thinking this is due to stress. I keep myself hydrated, and it subsided. But this one, I'm now suffering for 2 weeks. The GP told me have fluids, and he will give me a follow up to see me. So that's why he referred me to you.
Okay. Mrs. And is it large amounts, this diarrhea?
Yes, I'm emptying the toilet about 4-5 times a day now.
And it is it containing any solids, I mean, or it is just liquid?
It's liquid. It's more liquid.
More liquid. Is it offensive?
No.
Easily to flush?
Yes, easy to flush.
Is it containing any blood?
Noticed yesterday some blood, but I'm not quite sure. I don't know. Yesterday I noted some red blood in the loop.
This is the first time yesterday?
Yes, I noticed yesterday only.
Okay. And did you notice it is related to certain type of food?
I'm not quite sure. I don't know. I was eating food in Egypt, and food was delicious, so I was eating a lot of food. But I'm not quite sure it's related to the food or not.
Okay. Is one of your friends have the same loose motion?
No, this is weird. Most of my friends didn't have the same in symptoms that I'm having.
Only you?
Yes, it's only me.
Okay. And do you notice? You told me also. Is it about you from sleep?
No, it's not awakening me from sleep.
Okay. And what's about the tummy pain? Can you describe?
Yes, I have I can say it's crampy tummy pain. Come and go.
Okay. And Mrs. Ima, you came back from Egypt just 2 weeks back, and since you came, this you noticed this loose motion
Yes.
from the first days. Okay. And
No,
this
I noticed loose motion when I was in Egypt. It started with me at the end of my trip.
while you are there, it starts.
Yes.
Okay. At the day of traveling,
Yeah. On my last day.
and you told me this tummy pain in upper part of your tummy, or it is
No,
non-specific.
it's all over my tummy.
Okay. Is it like colics or something?
Crampy. Yes.
Okay. And what's about this temperature, raising temperature?
Yes. I was having this fever on and off.
Mhm.
So I was taking paracetamol for the fever. It's
Mhm.
helped me sometimes, but I'm feeling tired of this diarrhea. I become more tired and weak.
Do you notice any bleaching?
What do you mean by bleaching?
Okay, I mean feeling full or
No, I'm not feeling full. I'm not eating anything.
okay. And do you have any being sick or feeling sick?
I'm feeling most of the time sick, but there's no vomiting. There's
No
no
one.
yes.
Okay. And do you notice any yellowish change of color of your eyes become yellowish?
No,
Okay. Do you have any tummy distension?
no tummy distension.
And do you have any loss of appetite?
Yeah, yes, I'm having because this I'm feeling sick all the time, so I don't have appetite to eat.
Any lumps and bumps in your body?
No,
Feeling there?
feeling what?
There.
Tired.
There.
Yes. Yes.
And while you are there in Egypt, from where you have your food?
I was having food from everywhere, but usually we was eating in our hotel. So I ate most of the food in the hotel.
But you have some meals from outside.
Yes, sometimes I was having some meal from outside.
What's about the water supply?
No, I was drinking mineral water.
Are you supposed to any bowls there or animals?
Any what?
Bowls, water of bowls.
Sorry, I couldn't hear you. Can you say it again?
Water. To swim in pools or water from pools.
Yes, there was a pool in the hotel, so I was swimming in the pool.
Okay. Okay. And Mrs. Do you notice any weakness or any jerking of your limbs?
No weakness or drinking on my limbs.
Any? What's about your water work? Any
It's
change in
normal.
your water?
No, it's normal.
Okay. Do you have any soreness in your mouth or any other part of your body?
No,
Okay. And, okay. Do you have any cough or any shortness of breath?
no,
Hmm?
no.
Okay. And can I examine you during my examination? I may need to ask you some questions. Okay.
Okay.
Okay. Give me the vital signs.
Vital signs: blood pressure 90/60.
Any dropping?
Temperature, it's written to you, it's 37.9.
Any dropping in the blood pressure?
No, no dropping in the blood pressure.
Okay. And any signs of dehydration? What's about the
Yes,
mucous membrane?
she has dry mucous membrane.
Regard any pallor or jaundice?
No pallor, no jaundice.
a general look of the patient and
Hmm?
thing in the face of the patient, and abnormality, any discoloration
No, nothing in the
in
face.
the hand, also in the hands, any discoloration.
No discoloration in the hand.
No. Okay, and now abdominal examination, is any tenderness?
Yes, there's generalized tenders in the abdomen.
Okay,
No
organ,
organic. No
no
organ.
organ, no any previous scar.
No previous score.
Okay, any lymph nodes anywhere?
No lymph nodes.
Okay, okay, Mrs. Muna, can you tell me during are you? I want to ask you some special question. Are you married?
No, I'm not married.
Okay. Do you have any? Do you have partner?
Yes, I'm having partner.
Okay, I'm sorry to ask you some question. Do you have any unprotected sex? Practice and unprotected sex?
Yes.
Okay, this for a long time.
Yes, I'm using unprotected sex.
Okay. Okay. Do you drink alcohol?
Socially.
Okay. Do you smoke?
No.
Okay. What do you do for a living?
I'm now finished my university and now I'm in training solicitor.
Mhm. Okay. This is Mona. Do you have any past history of loose motion before? You told me that during the exam before.
Yes, only during the exam I was having some diarrhea for 4 days and it subsided on its own.
Just the last exam, but before do you have?
No, I didn't have before anything.
Okay. And do you have any past history I should be aware of a part of this cholecystitis or this gallstone? Sorry.
Only gallstones. No, I don't have anything.
Okay. And do you have any family history of note or any family history of loose motion?
Family history of loose motion. No. My father in good health. My mother was having mild rheumatoid arthritis. I have 2 sisters, both in good health.
Okay. And, do you take any medicine now, right now, a part of this prescribed by your GB last week?
I'm taking microgynon.
What? Sorry.
Microgynon, a contraceptive pills.
Oh, okay. This for a long time?
Yes, I'm taking for a long time the contraceptive pills.
Any over-the-counter medication?
No.
Do you have any piercing or tattooing?
No.
Okay. Do you use any recreational drugs?
No, I'm not using any recreational drugs.
Yes, sorry for this question. Okay, Mrs. Muna, just let me tell you in summary that you have these loose motions for the last 2 weeks, and it started the last day while you are in Egypt. You are now opening bowel around 5 times per day. Also, you have this there's high temperature or fever, and also you have this tummy pain. Okay,
Okay.
you are using contraceptive pills, and
Yes.
do you want to add anything else?
No, doctor.
Okay, Mrs. Muna.
If you want to ask me any other question, you can ask.
Okay, Mrs. And you told me while you are there, you are supposed to some boats, okay?
Somewhat?
Some water.
No. I was drinking mineral water.
No, I swim. You swim.
Yes, I was swimming in the pool in the hotel.
Yes. Okay. Do you have any skin rash or any joint pain?
Yes, I'm having rash in my leg.
Can I see? Can I have a look?
So you'll find in the both leg there is a bilateral
Mm,
G, bilateral patch rash elevated a little bit with and tender.
It is tender.
Tender.
Okay. You have any joint pain?
2 minutes left.
No joint pain.
No joint pain. Okay. Okay. Mrs. Zima, what is your concern?
I'm concerned about this diarrhea. I'm having infection or what's happening with me, doctor. I couldn't concentrate in my life. I'm now in training, so I don't know what's happening with me. Every time I'm going to the loo, which is very embarrassing me, and started I feel myself weak. So I want you to help me with that.
Okay. Mrs. Ima, from what you said to me and after examining you, we are concerned about is a bug cause of this diarrhea, and this may be related to your traveling to Egypt. You may have bug affect the gut, okay, leading to this area. What we need to do now is to run for you some tests, including test for your stool and some blood test. And also we need to admit you and to give you fluids and to run these fluids. Meanwhile, we need to admit you, may need to run for you also camera test, may need, okay, after stabilization, after you make you have stable condition, okay?
Okay, doctor. Okay.
Do you have any other concern?
No, thank you.
Okay.
Okay, perfect, Dr. Abdullah. Great. Let's go to the exam question.
Okay, so what is your diagnosis, doctor? And differential.
Okay. From this history, one of my differential diagnosis is my top differential diagnosis is it's not tropical spiro. The other one that infectious.
Weepel disease, you mean?
Weevil disease. Weevil disease. Yeah. Weevil disease. Weevil disease. In the top of the differential diagnosis. The other differential diagnosis, gardiasis. Also, I need to traveler's diarrhea will be in one of the differential diagnosis. Also, I need to rule out inflammatory bowel disease and gardiasis.
Okay, gardiasis. So this is all your differential, right?
In view of our HIV risk factors, also I need to put opportunistic infections on my differential diagnosis.
Okay, so and what investigation you will do for this patient?
Okay, part of the investigation, I need for the patient stool analysis, stool culture and sensitivity. Also, I need to do for her fecal protein, and I need to do viral infection screening, and I need to do for patient abdominal ultrasound plus minus colonoscopy.
Okay.
For this disease, I need to do serology and to do perform disease.
Serology for what?
For Weevil.
For Whipple disease. Okay. Okay. And what treatment you will give this patient when you will admit her?
I admit her. I will start by giving her fluids, good hydration for the patient, and then if I confirm Weevil disease, this will may need prolonged course of antibiotics. Use if according to the severity of the disease, may need to give her ceftriaxone, and then we can give her also doxycycline.
Ceftriaxone and doxycycline. Okay.
Yes.
Okay. And for how long you give, if it's Whipple disease, for how long you will give the antibiotic?
For 6 months. It will be long time, but I'm not sure.
I'm not quite sure. Okay. And what's the complications that can happen to this patient if she's not admitted?
Yes, dehydration. She may develop acute kidney injury. And if she has, because they have the differential, if this IBD, there is a risk of toxic microbiome.
Okay, I just want to ask you, this patient have a rash. Any significance of this rash that she's having?
with the diarrhea for 2 weeks.
No, the rash. I'm saying about she have a rash in her lower limb. Any significance for this rash? Hmm?
If I get as the description of this rash like Listeria nodosa, so it will be related to IBD on differential diagnosis and other infectious diseases.
Okay. Okay, I finished.
Also, because the description give me like this is also associated with some skin rash.
Okay, we finish on the investigation and management plan.
Yes, I finished.
Okay, last question from me, Dr. Abdullah. You said you will admit this patient
Yes,
based on
she has low blood pressure.
yeah, posture hypertension. You mean
She said she has no portal hypertension.
no posture hypertension? Okay, but
Yes,
still you
said
will admit her based on hypertension only.
this number of bowel motions.
So the
Okay,
number and
and dry
dehydration.
mucous membrane.
Yes,
Dry
dehydration
mucous membrane
status. Yes,
dehydration.
exactly. Yes. Okay, well done. And the time is already up for question. Let's hear the comment from Dr. Sarah, then I will comment. Yeah, you can start, Dr. Sarah, please.
So you did it well, but you missed some questions. I don't know why you diagnosed only Whipple disease, and it is was on the top of differential. So in the history you ask about the diarrhea, and you didn't ask about weight loss. So this patient has weight loss for the last 2 months. Okay, so she's having weight loss. And the other things you ask about joint, and you can ask also about any gritty eye or any redness in the eye. You need also to ask about, because she's female, pregnant, planning to be pregnant, her period. Okay, the 4P for female. Okay, you address the patient concern, but I think for this patient, and when examining, you at the end you examine the lower limb and said the rash. You can ask about the rash from the beginning. So this patient, she was just traveling in Egypt, but her main diagnosis now, the top differential is inflammatory bowel disease. She has erythema nodosum in her leg, which is painful, and raised rash, and she had this attack of diarrhea before. Her friend didn't have any positive uh, um, uh, the same symptoms as her, so there no other contact. It's only her. So I think yes, you will put the infective in the cause, but your main topic will be inflammatory bowel disease. Okay. For this patient, also you need to ask about any previous surgery or any radiation, because she might have radiation colitis. Okay, so the differential for this case it's not Whipple disease. Whipple disease, you will have joint pain. Okay, this patient doesn't have any joint pain. The most common symptoms, she will have diarrhea and joint pain. Sometimes she will have also more neurological symptoms for Whipple disease. Okay, so differential diagnosis for this patient: inflammatory bowel disease, Crohn's disease, or ulcerative colitis. You couldn't differentiate. If the patient is telling you I have some mouth ulcer, it might lead you to Crohn's, but you can say only inflammatory bowel disease, and you can say the infective cause. The infective cause, yes, in Egypt, it could be amoebiasis, Shigella, okay, and also if this patient is HIV, so you need to put the cytomegalovirus, cryptosporidium, Campylobacter also, and less common it will be irritable bowel disease, celiac disease, thyrotoxicosis, and it could be also radiation colitis, okay. And also yes, and you didn't ask also for the cytotoxicosis. Also, you need to ask some question about cytotoxicosis. So this patient has inflammatory bowel disease. She should stop the combined pills, because the combined pills are contraindicated. Also, non-steroidal inflammatory drugs are contraindicated, the aspirin and the ibuprofen. because it can precipitate the ulcers and precipitate the disease itself, and also the combined pills. Okay, so the examiner can ask you the normal question. He will tell you what is the difference between Crohn's disease and ulcerative colitis. So you need to be aware about this question. So ulcerative colitis usually affects the large bowel, the colon, rectum. The Crohn's can affect any part of the body from the mouth to the anus. Crohn's more common. You will have anal fissure, fistula, and it's transmural. Take all the layers of the of the gut. But ulcerative colitis, it's mucosal only. You can see some crypt abscess, and it can lead to lead pipe. But for Crohn's, there is a picture called cobblestone appearance. They can ask you also about the OGD picture. I'm not quite sure if you said that you will do for her OGD. This patient, yes, she's dehydrated, so you will admit her, give her IV fluids, and you start for her the treatment. You will include the gut, the multidisciplinary team. So you include the infectious team, and you include the GIT team. Okay, and examiner can ask you also what the extra intestinal manifestation of Crohn's disease. So you can see if the patient has a gallstone, she might gallstone disease, fatty liver, pancreatitis. She might have amyloidosis. She might have she might have clubbing, arthritis, erythema nodosum. Okay, so this is the extraintestinal manifestation of Crohn's disease. And also she might have pyoderma gangrenosum. Okay, this and one also of the differential, it could be diverticulitis. Okay, and infective colitis. Not infective colitis, it doesn't mean that there can be an organism. You cannot have an organism also. So you will admit her for supportive treatment only. Okay, and if the patient has a history of antibiotic intake, it could be pseudomembranous colitis, but I think it's less common. Okay, and also they can ask you about the extra also intestinal feature of Crohn's disease. As we know, of inflammatory bowel disease, she might have primary sclerosing cholangitis, uveitis, episcleritis, osteoporosis. Okay. This is my and for the investigation, you will put the top of differential inflammatory bowel disease, and then you will add the infective is the second differential. Okay, so you will the investigation you will do for her full blood count, the inflammatory markers, the renal function, check for the dehydration is affecting her kidney, and the liver function. You will do for her an X-ray abdomen, which is important to exclude toxic megacolon. You might do for her an ultrasound. And
LCC, full blood count,
and OGD. You can do for her an OGD also, or colonoscopy according to the. You can add all this investigation. So this is all my comment about this patient.
Sorry, doctor. Is combined contraceptives contraindicated in IBD?
Yes. Combined contraceptive pills are contraindicated. Isotretinoin contraindicated, non-steroidal also. And also, if she's pregnant, so there is some medication contraindicated while she's pregnant, as methotrexate. We couldn't give her methotrexate while she's pregnant. The treatment is menstrual stay treatment. We give her corticosteroid or give her mesalazine at the beginning, and she might have infliximab. Okay. So this is, I think this is the station. I can add two things. You might have in this station, in the exam, a patient, but he has stoma, colitis, or ileostomy stoma, or colostomy stoma. Okay. So if it's ileostomy, I think it's more common. It will be, I think it will be ulcerative colitis, right? But I'm not quite sure of this. Dr. Bassem can correct for me. For the ulcerative colitis, they will have ileostomy or colostomy.
Ulcerative might be colostomy. If the patient did colectomy, it might be ileostomy.
So the Crohn's will be ileostomy, right?
The Crohn's ileostomy, yes. But
Yes.
some certain situation, ulcerative colitis will be associated with ileostomy if the patient underwent total colectomy.
Okay.
So
And
no
the-
more colon.
Okay,
It
and
will
the other things you can differentiate between the ileostomy and colostomy. Usually, the colostomy, it will be
Yes.
on the left side, and the stool will
Yes.
be solid, mostly formed
Solid.
stool.
Yes.
And
Formed stool. Yes.
and you will see irritation of the skin around the stoma. This irritation of the
Ileostomy.
skin in the colostomy because the
No,
stool.
no, in the ileostomy.
No, I'm saying about the colostomy now. The colostomy.
No irritation of the skin in the colostomy.
No, the colostomy irritation of the skin because the stool can irritate the skin. The
Not
ileostomy.
the stool. The opposite, you mix. The stool is not irritant. The irritant is the gastric, also the chemical and the excretion of the small bowel. That's why the ileostomy will be like
No,
burned.
they told us this. I don't.
It
I
is
didn't say.
regarding to the disease. Crohn's tend to ulcerate and tend to make like stoma problem. But ulcerative, no tendency to do like the
Yes,
Crohn's.
the ileostomy. I wrote it. The ileostomy. It will be in the right iliac fossa, semi-solid liquid, will not flushing of the skin. But the colostomy will be fecal content, and it does cause flushing of the skin.
You will not attach it to the skin. It is bag. It is like
Yes, but the
I
skin
saw
surrounding
it.
will be
It is you
irritated.
will not see the skin. It is just continue to.
No.
But the ileostomy is a problem with the disease itself. It is mainly Crohn's, and the Crohn's concern ulcerative ulceration in the stomach. It is one of complication. In ulcerative, you will not find that, but already they like making no seal between the opening and the bag. And
Yes, I
this is
know.
one yeah.
But they was telling us in the course that if you find redness around the skin surrounding the between the يعني ما بين الاتصال of the skin and stoma, you will find if redness, it mean it's cholesterol because the stool is
No,
irritated.
I mean they said like that. Why? Because the ileostomy they will not making the border up, like, but in colostomy they making the border like inverted. They will like fix from up. In ileostomy they can't do like that.
Okay.
You get me
Yes.
or no?
Yes,
Yeah.
I get
It is different procedure.
Yes,
I think they mean that.
maybe
yes,
yes.
skin irritation and ulcers come with ileostomy.
Yes, ileostomy.
Come with ileostomy because the content is more liquid and it contains enzymes.
Yeah, this is what I said. Yes.
Yes, in colostomy.
I will ask about this.
Yes.
Okay. Yes.
No, the opposite, doctor. I'm 100% sure. As all mentioned, it's the less. Continue, doctor. Sorry, I have to interrupt you. I interrupt someone. Please continue.
Okay, you are right. Okay.
No. There is doctor. He was talking. Sorry, doctor.
Yeah.
I interrupted you. Can you please continue your talk to confirm our talk?
Yes, skin irritation is common with ileostomy because the content is more liquid and contain enzymes. In colostomy, you might find skin irritation and ulcers if the clearance was inappropriate, but less commonly to find skin ulcers and irritations in colostomy because the content is more solid and less containing of enzymes.
Okay, so that's good. I didn't know that. It was telling me the opposite way. Okay, thank you.
Okay, thank you, Dr. Sarah. A very nice case, as common case also. The
Yes.
second thing, you prepare the case well, which is also good for you and good for us. We are learning from you and you are teaching yourself. Really, this is the best way how to learn from others and to teach yourself by reading the topic well, and you will present it well. So it will make this topic more clear for you. Okay, the case you did it as a candidate, you will learn from, and the case you learn from as surrogate, also you will learn because you are focusing in the information. Try to read as much as you can from now till the exam, the topic which is common, and to present some of them, and the missing to either to practice. Of course, you will practice with someone who will give you a case. If you know this topic, read about it. And the missing topic, you can prepare it as a surrogate and read about it. Hopefully, you will pass. You are doing well while you are doing surrogate and the presentation as well. So you present the case well. Let's go to Dr. Abdullah. Dr. Abdullah, first time to practice with me. So he's too much confident, calm, which is very good.
Yes.
This calmness in the exam will help you. Regardless the performance and the information, they are not judging that much on the information as
Yes.
much as they are commenting or they are stressing on you. Once you are calm, you can answer, you can do everything, and you can do the examination of the patient taking good history. But the stress sometimes let you confuse and
Block.
mix between history. Yeah, mental block, of course. This is what happened.
I'm afraid.
Actually, even the name of the patient you might forget.
I know.
You are writing the name in the paper, but I think they are even deducting you while you are looking to the paper. So try to memorize the name before going inside the station. This is very important because most of the cases I forget the name because of the stress. I guess the minus for that because my defect was in the clinical communication, and I don't know what the comment, but I guess because I was looking to the name, even the name you forget from the stress. So this is general advice. Please memorize the name while you are preparing for yourself in the 5 minutes. The name of the patient, repeat it many times because you will go inside. You're not allowed to look to the paper. Okay? And be sure who is the patient or the surrogate you are talking to. Don't mix. This is also another point you will be doing during the stress. And from my side, I don't think really this can affect your mark. I don't know why some examiner sick can do that, but they did it with me. I mix between surrogate and patient, and I guess they deduct my mark for this thing. So this advice, please put it in your mind. Don't mix and try to memorize the name of the patient. Don't sit in front of the patient. You are forgetting his name or her name and to look the paper and look to him back. I think this one will minus you for. Let's go to the other comments. As the diarrhea, the main complaint here, Dr. Abdullah did good questions, screening for the diarrhea, the travel history, awaken you from the sleep, the alarming signs. Any complaint you have to check for the alarming signs. In this patient, the blood, the frequency, the amount, and the dehydration signs. You have to roll this out, and it will be clue for you. Whatever you have some of the blood, so it's correlated to irritable bowel syndrome, sorry, inflammatory bowel syndrome. Alternating constipation with diarrhea, so it's irritable bowel syndrome. History of skin rash, and please don't miss the skin rash. Sometimes it's the clue for the case, as in this patient. And don't deny it or just neglect it. Whenever you have skin rash, you have to look at, and it will help you to guide you to the case. And in this patient, irritable inflammatory bowel syndrome, you can get the diagnosis from the rash itself, either by dermagangrenosom for ulcerative colitis or erythema nodosum for Crohn's disease. The jaundice itself also can be associated joint pain. You have to ask these systemic question with inflammatory bowel disease. Yeah, sometimes they will bring Whipple disease as a case, but it's not that much common. But you can put it in the differential, but not in the top. In this patient, don't put the Whipple in the top. You have to put the common first. Celiac, you rule out the celiac, right? Relation to the food. I think you ask for relation to the food. And also you ask for the intake or the food in the travel history. I think you didn't ask this, Dr. Abdullah. Did you ask about where did you take your food from local restaurant
No, yes,
or
he asked.
he asked? Okay, good questions.
About swimming.
Excellent. The question also for swimming, the hotel. Sometimes it might come as a clue. The hotel will guide you to Legionella pneumonia if the patient, I mean, another complaint. So he will present with a typical pneumonia. It's not related here, but I mean, by the way, okay? Let's go to the other thing here, the travel you asked, the HIV history you asked. She told you unprotected sex, but with whom? You have to be clear, with the partner or with casual relationships. That's why you can put HIV and you can roll it out. She said to you, yes, I have unprotected sex. With whom? Maybe with her partner, so it's clear and then nothing will be risky. If she said, no, doctor, I have casual relationship with unprotected sex, this time you can put HIV in the top. But your all question for HIV were good. You asked for sharing needles, recreational drugs, any tattooing, piercing, blood transfusion. All this question was good. The job you asked and social history, I mean, for the support, does she need support? Is she fine? Also for the smoking and alcohol, I guess he asked, right? Because,
Yes.
yeah, okay. I
Yes.
think Dr. Abdullah did great history, really. He took good history and he did examination in proper time. And while he's doing the examination, he asked some other questions. But add to this question the skin rash before going to the patient, skin rash and the joint pain. In the examination, lymph node in any diarrhea or infectious case, you have to do. Believe me, in FMF, as a case in the exam, they minus the doctors who didn't examine the lymph node. While it's not related, but because the patient came with diarrhea and abdominal pain, they need from you to examine the lymph node. The joint also, if there is extra manifestation, extra GI manifestation, you have to do joint pain, even like acting. Yeah, I'm checking for the joint, any abnormality like that. Just act like you are doing joint examination. Some tricky point, and for you it's nothing, but for them it's very important. Whenever you have positive history or positive finding, put it in the paper and do examination for it. For example, you found that in the history there is skin rash. You have to examine the skin rash. If you didn't do the skin rash examination, even it's not present, you have to act like you are examining the rash, even it's not there. Just show me your rash. No, doctor, it was here but disappear. Okay, go to the leg and examine for this rash. Maybe it's not there, maybe there, whatever. Just do like you examine the rash. Okay. I cannot say more than Dr. Sama mentioned in the topic of infectious diarrhea and the differential. So let's repeat the differential here for any diarrhea and bloody diarrhea. In the top, you have to put inflammatory bowel disease, celiac, I guess it's not, but you can put it also, and infectious diarrhea. And very important thing here in the history and differential, Dr. Abdullah, you ask about family history of diarrhea. You have to ask about family history of cancer colon. Specifically, once you have blood in the stool and patient loss of weight, you have to ask about any family history of cancer colon specifically. Why? Because you know the Amsterdam criteria, it might guide you. There is family history of first generation or second generation cancer colon with death or whatever. You have to ask specifically about this thing, okay? Apart from this, you did great. Let's move to the second case. Dr. Abdullah, can you write your case for Dr. Sarah? I will
I
need
just
some.
add
Yes,
with investigation we can add fecal calprotectin,
yes,
and we'll do
yes.
also this patient will go surveillance for cancer, and
Excellent.
for the examination, keep in mind sometimes bringing patient with ileostomy and colostomy and complaining of diarrhea. Okay,
Mhm.
so try to search for the radiation tattoo, because this also this could be the clue for this patient, that if you find the radiation tattoo, so this patient has radiation colitis.
Yes, radiation, yes.
And it's
But
very
I,
minute, small
yes, very, yes,
round,
yeah, yeah, very
and
tiny.
they make the station, all the station about the small radiation tattoo.
Okay, but let's be more I mean, clear for this point especially. You can't find the radiation tattoo in the abdomen. It's very small. So the best thing is to ask about any radiation before or any surgery, any procedure, rather
But
than asking.
and positive, and you will find, and you should find it in the examination.
Of course, but after knowing there is history of radiation, how you guess there is radiation tattoo by your eyes and you are just scoping all his abdomen, where is the tattoo here, where is the tattoo here, and no history of tattoo. This is
Yes,
my
but
point.
sometimes you can see this tattoo while you do the clinic,
Sometimes,
the
yes,
examination itself with no history. So I need to say it if you see this radiation tattoo.
yeah, it could be also. Yes, you're right.
Yes.
Okay, Dr. Abdullah, did you write the case? Your case scenario, please.
Yes.
السلام
35.
عليكم
وعليكم السلام ورحمة الله وبركاته.
على الجميع مساكم الله بالخير.
أهلا
I
دكتور
have
محمود.
a question here and comment. I think Weevil disease cause malabsorptive diarrhea.
Yes.
Yes, related. My question here is when we get patient has unprotected sexual practice, we need to advise.
If casual
and
relationships,
we
yes.
need to
Yes,
practice
immediately
safe sex.
advise. Not stop it. He
To-
has the
to
right to do whatever he wants.
safe
But
sex.
yes, yeah.
Mm.
So
This will
the
affect
advice,
welfare, I think.
yes, sure. Yes, this is a risky habit, and if he continue doing this habit, he will get another infection, either HIV or other sexually transmitted disease. So you have to be safe and clear about this advice. And another advice for whenever you have something which is risky, immediately advise him. You will forget it by anyway. If you didn't do, don't tell me you will do it at the concern. Never ever. At the concern time, you don't have the time, or you have only the time to advise about the three concern. He will not give you one concern at all. Don't think that the surrogate will ask you one concern. No, no. They are giving you three concern, waiting for the three answers. So don't think he will tell you, Doctor, what I have, and that's it. No. And if you ask, what's your concern, please make it, what are your concern? Make it in, not one comment or not one concern. Because if you ask him, what's your concern, and you start to explain, you will take 2 minutes explaining for things and he didn't ask it. And when you go back, you have another concern. Yes, doctor, I have. Time is up. So what to do? Ask, what are your concerns? Doctor, I have 1 and 2 and 3. Start to reply one by one. And if you forget, you can ask him again, can you tell me what was the third concern? Yes, doctor, I have one, for example, why I have like this, is it curable or whatever. So the best thing to make him enumerate, then answer one by one, rather than asking him one concern and he will tell you one concern, then you will start to explain till the end of 2 minutes and you will never get the other concern and you will be minus in the concern. Okay, is it clear, Dr. Mahmoud?
Yes, clear, thank you. And otherwise, I think he did well and great, well organized, and also good communicator, I think.
Yes, he did great. Yes. Thank you, Dr. Mahmoud. Dr. Sarah, are you ready? I know we didn't read the scenario. Let's read the scenario. 35 years male who is found to have hemoglobin 10 during routine checkup. Refer to you for further assessment. If you are ready, let us know.
Okay, I'm ready. Hopefully.
Okay, no, you can do it. Really, I need you to be confident.
I
and
tried to make all the defect last time, to concentrate this time, no mental block, all the history, Fatma, and everything.
Excellent. Yeah, if you follow this, just go back to the system review, check what system you missed, and you will complete the history, jump to the examination, then the concern, you are done. Let's start.
Yes.
Yeah, you can do it. Let's do it. Very
Hello?
Hello.
My name is Dr. Mahmoud. I'm one of the doctors here in the clinic. Am I talking to Mr. Joe?
Yes, doctor.
Can you confirm your age for me?
Yes, I'm 35 years.
Okay, I can see that you have been referred today because there is some to check your blood results. Is that right?
Yes, doctor.
Okay, did anyone explain for you anything about the result?
Sorry.
Anyone explain for you the result of the test that you did?
Yes,
Okay, so can you tell me how much do you know
I
about your
believe that I have low blood.
low what?
Low blood.
Low blood. Okay.
Anemia, yes.
Okay. And can I ask you why you did this test at the first time?
Yes, during routine checkup because I I will be I have been accepted in a new job. So this is routine checkup.
So you did this test as a routine test, right?
Yes, yes.
And what job you was preparing to have?
The soldier.
Soldier?
Yeah.
Okay. So I just want to let you know that here I will explain for you the result, but I need first to ask you about some questions about your health, and then I will examine you, and then I will address all your concerns. If it's that okay with you?
Okay.
Okay. So can I ask you? As I told you, yes, you have low blood, and the test shows that you have low blood. But I need to ask you more question about that. So, do you feel any tiredness?
Sometimes, doctor.
Sometimes. And since when you feel this tiredness?
Well, doctor, this is not okay for a long time, but for maybe for the last 5 years.
5 years you feel yourself tired. And are you
Yes.
able? Can you tell me more about this tiredness? How it affects your life?
Doctor, it is not that much okay. You know, sometimes I feel tired, and but this not affect me too much.
Okay. Do you have any shortness of breath?
No,
Any chest pain?
no,
Does anyone told you that you look pale more than before?
no, doctor.
No. No?
No,
Okay. And have you noticed any fever?
no,
Any weight loss?
no,
Have you noticed any bleeding from any part in your body?
no, doctor.
No. And even if you have you noticed your stool is dark or black?
No, doctor.
Okay. And do you have any pain in when you swallow?
No,
Any rash in your body?
no, doctor.
You told me there is no weight loss, right?
Yes,
Any joint pain?
no.
Okay. Do you feel any heart racing?
Sometimes, doctor.
Sometimes. And can you tell me more about this heart racing?
Yes, doctor. When I have do strenuous exercise.
So only with exercise, not at rest?
Yes, not at rest.
And you feel it fast?
Yes,
But okay. And okay. Any cough?
no,
Any dryness of your eyes or redness of your eyes?
no.
Any change in your bowel habits?
Yes, doctor.
Can you what change in your bowel habits?
Yes, doctor. I have these loose motions come to me from time to time.
Lose motion.
Yes.
And how many times you enter to the loo per day?
Okay, doctor. This is not continuous. When this may happen once per week or every 2 weeks or something, but it's just losing its content.
So you mean
Frequently, 3 times
three
like
times
that.
3 times a day, but not every day. You mean that?
Yes, This for long time, this is not new for me.
Long time. Okay. And have you noticed that you have this loose motion related to specific type of food?
I didn't know.
You didn't notice. Okay. And can I ask you about your diet? You follow any type of diet, vegetarian diet?
No,
No. Okay. And no one told you that you have any allergy to any type of diet?
no, doctor.
Okay. Okay, no heart racing, no. Have you noticed any lumps or bumps in your body?
No,
Any also regarding your urine, when you go to the toilet or the loo, you notice any pain when you pass urine?
no, doctor.
Any frost urine?
No,
Okay. So no heart racing. And you didn't notice? Do you have vomiting?
no,
Do you feel sick?
no,
Any change in your appetite?
no.
No. Okay. Yes. Okay. So I just want to ask you some question. Do you have any medical condition?
Yes, doctor.
What do you have as a medical condition?
Yes, doctor. I have the met a doctor, my GB follow for what we call IBS.
For what? IBS?
IBS, yeah.
Oh, IBS. Okay. And why the GP is following you for the IBS? Because the loose motion that you have?
Yes, doctor.
Okay. For IBS. Okay. And are you taking drugs? Any medication? Sorry.
When I become trouble with that, I
Yeah.
use, yeah, when I stomach for stomach pain, I use hyoscine and also I use lopramide sometimes.
Hyoscine and bromide?
Lopramide, yeah.
Lopamide. Okay. And do you take any painkiller?
Not frequent, doctor.
Not frequent. Okay. And do you have allergy to any medication?
No,
Okay. And just some question regarding your social life. Do you smoke?
no, doctor.
And what about alcohol?
Occasionally only, doctor.
Occasionally. Okay. And you told me that you will preparing for your job as a soldier, but
Yeah.
what do you do for a living right now?
Yeah, I just finished my college, doctor.
My college. Okay. And how this tiredness tiredness affecting your life?
Doctor, it is not like more trouble. When I have those motions, become more anxious, more tired, like that. But in 3 days or free time, it doesn't affect my life.
Okay. And have you noticed with this slow motion any blood?
No,
Okay. And any recent history of travel?
no, doctor.
Does anyone who do you live with?
Yeah, they live with my family, doctor.
Okay. And anyone at home has diarrhea or same as you?
No, doctor.
Any family history of note?
No, doctor.
No. Okay. And even of cancer?
No,
You told me you have only inflammatory bowel disease. The doctor is investigating for inflammatory bowel disorders. So you don't have any other medical condition?
doctor. I didn't have inflammatory. It is called IBS,
Yeah,
irritable bowel syndrome, doctor.
yes. Sorry, IBS. Okay,
Yeah.
and any other medical condition?
Yes. No, doctor. Just I have this asthma before, but since childhood, yeah, I think now it's controlled.
It's controlled. And you what medication you are taking for this asthma?
Just Ventolin, but this may be just in winter. I need to.
Inwint.
Mm.
Okay, and regarding This asthma, the GP diagnosed, he did for you some exercise test and some, how he diagnosed this asthma?
Yeah, this in childhood, doctor.
Just in childhood, okay. And, okay, so, I would like to examine you if it's okay with you, okay?
Okay.
First of all, I would like to check the vitals.
Okay, it's normal. It's normal.
Normal vitals. Okay, and then I will have, I need to have a quick listen to the, I need to check for elevated GVP.
No, normal. No, not rest.
Okay, any lymph nodes in the neck or the axilla?
No,
Any, for the eye, any jaundice or pallor?
some color. Mild color.
Some pallor.
Mm.
Okay, and I need to check the mouth for any glossitis, ulceration.
No, nothing.
Nothing in the tongue. Okay, and the heart, any murmur?
No,
Any crepitation?
no,
Okay, and the abdomen, any organomegaly?
no,
And the lower limb, any rash?
no,
Any lower limb edema?
no.
I just want to ask you a question, Mr. Joe. Are you sexually active?
Yeah, doctor.
You are sexually active. With a stable partner?
Yeah, stable partner.
Stable partner. Okay. For how long?
Yeah, maybe for 10 years or like that.
10 years. Okay.
Yes.
Okay, do you use any recreational drugs?
No,
Okay. And do you drive?
yes.
Okay. Okay. So, Mr. Joe, I just want to so after examining you, I would like to run for you some tests, okay? And so I'm not quite I don't think that you need to be admitted. So I will do for you some tests now to check you, and we keep you in the observation room, okay? To see what because I need to do further investigation for your blood and the tiredness that you have and this heart racing. Okay. So and also you might have these symptoms, and it could be related to some problem in your gut, okay? So that's why I would like to admit you and run for you some investigation. So I will come back to you with the treatment plan and what we will do next. But can I ask you what is your main concern from today?
2 minutes left.
Doctor, you will admit me or you?
No, because I checked your vitals. You're mostly stable. So I would like to keep you with us in the observation room. We will run for you more investigation because I have only one blood test for you. So I need to do for you some blood tests, some urine tests, and some scanning. And then I will let you know about the result, and if we found something that need to be admitted, so I will discuss it with you, and we might admit you. Okay? And do you have any other concern?
Doctor, is it serious to have this low hemoglobin?
I appreciate your concern. So your hemoglobin is low. It could be serious if we couldn't find the cause and it's not treated properly, because we need to know exactly the cause of this low blood and treat you, because it can affect your heart and can cause for you some risk. Okay. And do you smoke? Sorry, I forget to ask you. Do you smoke?
I told you no.
I'll ask you. Okay. Okay.
Doctor, is it cancer?
Is it cancer? Cancer is one of my differential, but it's unlikely, but we need to exclude it. That's why I will run for you some tests and to exclude the cancer. Okay. I finished.
Okay, let's go to the examiner question. So Abdullah, you can start.
Present your case.
So So I examined this gentleman who's presented with he did a test, a routine test for his job. His hemoglobin was 10. So and he was only complaining of intermittent loose motion without diarrhea, without blood. He doesn't complain of any weight loss or any flag of B symptoms or flag for cancer. So for this patient, on examination, he doesn't have any stigma of heart failure related to this low blood. So I would like to do for him further investigation in order to know the cause. So my differential, it could be anemia, it could be due to chronic blood loss. So we'll
Do you find anything in history or
no,
examination?
nothing in the history.
Okay, what else?
And diagnosis.
With this
And
age group, he's 35 years.
yes, it could be the tiredness related to the thyroid. But
Do you ask about symptoms of thyroid?
no, but he didn't have weight loss or weight gain.
Okay, what else? He's
And
35 years old. He has symptoms. He's diagnosed as IBS. Do you ask about the diagnosis of IBS
yes, I asked him.
based on what?
He told me that he has IBS under diagnosis, and the GP is giving him treatment. But I asked him about loose motion and if it's related to specific type of diet. Maybe I didn't ask about stress or condition in his life. I don't know. Okay.
Okay, how will you investigate this patient?
So this patient, I would like to do for him routine investigation, full blood count, renal function, liver function, inflammatory marker. I would like to do for him complete hematinics, and also I will do for him iron profile, and will do for him iron profile, and also I would like to him reticulocytic count, and would like to do for him urine analysis.
His main complaint is diarrhea.
Yes, and urine analysis and stool, and I would like to do for him stool culture, occult blood stool.
Mhm.
And we might need also to do for him an echo for the heart if a doubt, and he might need OGD. And specific,
Might need or you will do it.
yes, I can. But I need after this test, I will. I can do yes OGD to check the cause. And also, I think we can do for him also some specific tests for my differential. So he might have celiac disease. He might have IBS, inflammatory bowel disease. And also, I need to do for him thyroid profile,
Mhm.
ECG.
Okay, doctor. Now, your the differential diagnosis will be, you can stratify again.
Okay,
What
so
will be in the top?
my differential diagnosis is good anemia, iron deficiency anemia related to peptic ulcer, or could be related or peptic ulceration or parasitic infestation. It might be. It could be celiac disease.
Mhm.
It could be inflammatory bowel disease, thyroid. Um, this is my differential.
How will you manage this patient?
Yes. We'll manage him according to the cause.
If he has celiac disease,
Yes, for celiac disease, we'll do for him. We need to do for him endoscopy. We need to give him a gluten-free diet, but do the endoscopy and then offer the gluten-free diet. And for investigation, I need to do for him transglutamyl transferase antibody and peroxidase. I forget this too. This the two tests, anti-transglutamin transferase antibody and myeloperoxidase, I think, something like that. Okay, only I forget the name about these two tests. And the endoscopy will confirm the diagnosis of celiac disease.
Thank you.
Okay. So what is the diagnosis?
Excited.
في كارثة أنا
No.
أساسا.
But sorry, Dr. Abdullah, I will tell her just one comment because I will compare her performance today to the previous scenario. You fulfill the 15 minutes, which is much better. The previous
Yes.
case you finish at 9 or 10,
Yes.
which is very weird. Okay, let's hear Dr. Abdullah comment, then I will comment.
Okay. اتفضل يا دكتور عبد الله.
Yeah, so, you did well regards the history. The trick in this scenario may be just the diagnosis of IBS itself. You need to review the diagnosis based on what, because here, and also you do analysis for the diarrhea, but I want to point to lead you toward onset of the symptom. Okay, but you didn't ask about. I told you it's 5 years. Also, you're passing. You didn't dig deep on. This when I was diagnosed as IBS, but at that time it is not. The workup was not complete. Okay, so this early thing, but you do screening for all the differential diagnosis regards other autoimmune disease, screening by systemic review also. I think also say colon or bowel cancer is one of the differential diagnoses regards Amsterdam. You need to ask directly about family history of gut cancer. Okay, not just a gut cancer. You ask about family history of cancer, yeah, but gut cancer. This is because this the differential diagnosis between celiac disease and colon. Okay. You ask about alarm symptoms. Yes, and do screen for it. But maybe some of it you ask directly and some cover with systemic review. You did well overall. Examination is just normal. Yeah. I think a part of Sambala.
Yes.
Do good examination. Maybe just you need to look for in the hands or like that for any
Clubbing.
yes, not clubbing. I mean leukonychia or something. Yes. Investigation manner. Always from the when you have investigation with referral letter, I mean, you need to do analysis for the result. You did that when you have investigation low hemoglobin. You ask about the symptoms of anemia. Also in the examination, you need to look for anemia and its complication. Also in investigation, you need to complete the workup for anemia. Okay, and I think you did, but some of the tests, not all. Then you need to tell also this one of the important things. You need to tell the patient that I will do for you camera test. Okay, one of the concern will be about the camera test. I need to do for you camera test because these patients with symptoms of diarrhea for a long time and he has low hemoglobin. You need to do for the patient camera test and you need to tell them that I will do for you camera test. Not maybe. Upper and lower, both of them. Okay. This in the workup and also in the communication with the patient. That is it. Then will be sure about the questions will be about workup for celiac disease, how to diagnose the investigation, and also about that is. Thank you.
Okay.
Yes. Also,
Sorry, Dr. Abdullah.
sorry, the mic was to tell that I will do for you camera test. I may need to take a snip, because when we have the biopsy, we need to mention to the patient.
Yes, yes, I agree.
When you will do biopsy, you need to mention that, not in the discussion only. You need to mention it for the patient. I will do for you camera test.
So
I
will admit this patient.
Also, no need to mention admission. Okay, this part of the way.
Maybe as outpatient.
Yes, exactly. But you need to mention for that, Mr. Ahmed, we will do for you some tests that include camera test. This is what we call the scope for your upper part of the gut, and may need to take a snip, and also may need to do for you another camera test for the lower part of your. Okay.
Okay, thank you so much.
Okay, thank you, Dr. Abdullah, for the case. Well done, really, Dr. Sarah, much better.
Thank
Okay, really.
Thank you, Dr.
Regarding the time, the questions, the social, the occupational, you ask everything. Even you don't reach to diagnosis.
Yes.
This is not at all.
Yes. Okay.
Don't be intentional because of that. You
Okay.
might mention the differential, the diagnosis and the differential, and you will get very good mark. Sometimes, yes, you have to reach, but some cases are vague with the symptoms, vague signs. There is anemia, yes, but I ask everything. The only question you miss any blood loss from any other area from your body. But you ask about any blood coming from back
No, I
passage.
asked him any blood, any
Yes.
bleed from any part on your body. I asked.
Okay, great. If you ask, this is very, yeah, that's it. So you will ask about any dark stool as you did, any black stool, any foul smell stool. This is with melena.
Yes.
Any blood also in the water work is very important. Sometimes patient will have microscopic hematuria and he will have iron deficiency anemia. If female patient, you have to ask about the period. Yes, is there any blood loss, chronic blood loss? It will guide you also to chronic microcytic hypochromic anemia. So you have to roll out all these things. So in our patient here, patient is present with diarrhea, mostly malabsorbed diarrhea. It might be celiac related to the food. So you can ask, is it related to the food or did you notice? And you can specify what food. He might say, no, doctor.
Yes.
Okay. Yes. And sometimes I didn't hear words, but I'm repeating just for others, not only for you. So to learn all of us. If you ask this question, is it related to the food? He said, no, you have to specify. Did you notice? Is it related to pizza, pasta, beer? Even certain alcohol will be associated with celiac.
Yes, beer, yes.
Yeah, beer. He might drink wine and everything is okay. He might drink beer, but he will deny food, and it will be the beer is the trigger for his condition for celiac. So you have to specify certain foods or drinks to reach to the diagnosis. Good question also ask about vegetarian diet. Do you have not malabsorption, sorry, they will have dietary anemia due to also vegetarian vitamin B12 deficiency. This is one of the cause of anemia due to diet. And this is a good question in anemia patient. So the beginning of the case was great to ask about what, the result and what symptom related to the anemia. But I want you to ask as low blood count, not low blood. It's called low blood count. Anemia? Yeah, low blood count.
Okay.
Okay, and the symptoms of anemia, you have to ask it clear. Do you notice or anyone notice that your eyes pale than before or your hands? You have any dizziness while standing from sitting position or any blood loss from any area? This question for anemia. Okay, and in the examination as well, you have to check for cholinicia. It's very important, and leukonychia. And the pale hand, the pulse itself, 3D weak pulse, or hyperdynamic, whatever the patient is having. If there is associated with liver, you have to check for jaundice. But I guess in this patient, it's malabsorptive diarrhea, so could be iron deficiency or some vitamin deficiency and maybe folic acid if celiac disease, folic or even vitamin B12. The differential, as Dr. Abdullah said, celiac, and you have also irritable bowel syndrome, complicated, maybe associated with cancer if the patient might have cancer and he thinking this is irritable bowel. But you have to ask about blood in the stool, and you asked it. But still, irritable bowel, one of the differential, he might have still diarrhea and he's not taking orally well. He is following diet, as you said, maybe he's vegetarian. All these things will affect his condition and might lead to anemia.
Yes.
And cancer colon, as Dr. Abdullah said, you have to ask specifically any family history of cancer colon, not only if in a family history of same condition. Yeah,
No, I
he might
asked family history of cancer only. I should say cancer colon or
cancer colon, yes, cancer colon, not cancer colon. Maybe cancer irrelevant and non-related to his condition. He will say yes, okay, but also he might think it's not related and he will not mention.
yes,
He,
you're
he
right.
might yeah he might think this is cancer. He has grandfather or someone cousin from the family as a Amsterdam criteria, not only first generation, even second generation he might have, and he will be still having risk for that.
Okay.
Okay,
And
clear.
how we will say the diagnosis of IBS if the patient is not aware of diagnosis? How we say the diagnosis of IBS is
Yeah,
functional
so
or what?
yes, functional disorder, and you have to
Patient
screen the
will
question.
understand the meaning of functional disorder.
Yes, you can explain hyperreaction of the body or overreaction of the body to the stressful condition in your life, which lead you to have these symptoms, which is sometimes tension headache, sometimes irritable bowel syndrome, as in the form of diarrhea.
It means can you say it again? Overaction of the body to stress.
Yeah, overreaction to the stress in the life might lead to these symptoms. Simply be simple in the explanation. Don't go deep and explain something he will not understand it.
Yes,
Okay,
you are right.
simply, yeah, overreaction to the symptoms, to the stressful condition in your life. Maybe you are not sleeping well, the mood. Also important question here, the sleep and mood, because he has irritable bowel syndrome, and you have to ask him about the symptoms of irritable bowel. Did you notice? Is it a change? So it will be alternating constipation and loose motion, right? Hard stool and loose stool. You have to ask this question. These symptoms change recently. Did you notice increase of the frequency associated with foul smell stool or whatever? So if it change criteria, so you can get clue for pathological condition. Irritable bowel disease, just watery diarrhea associated with stress. But if not, if awaking him from sleep, this is not irritable bowel syndrome. Irritable bowel syndrome will not awake him from sleep, right? So you have to ask this question.
Yes.
Does it awake you from sleep? No, doctor. So this is irritable. It's awaken him from sleep? No, this is different now, and it changed. There is different pathology. It's not irritable bowel syndrome. Okay?
Okay. Yes. Okay. And the two name of celiac disease antibody. Can you say it?
Yeah, TG, anti-TTG, anti-transglutaminase antibodies.
Anti-transglutaminase.
As you mentioned, yeah, but no peroxidase. You said peroxidase? And you have to mention also the IgA screening.
Anti-endothelial antibody. Anti-endothelial.
Anti-endothelial, the other one, yeah.
Yeah.
Whenever you are doing the antibodies, you have to do IgA screening. Some patients have IgA, so it will be deficient, so you can do IgG.
Yes, you're right. Okay.
Okay. One more also advice. If he said, yes, I have partner and a stable relationship for 10 years, don't ask him for how long. What's the matter of the
Because I was
duration?
thinking he is his stable partner for 1 year and before
Okay.
casual.
Okay. So you can ask different question by different. Did you ever have any casual relationships resent, yes.
Okay.
That does make sense, right? Rather
Yeah.
than saying him, yeah, is he stable for how long? So
Could
make the question.
here when we are asking this question, we are shy at all.
This is your specialty,
We
yeah,
are not
infectious.
even in the exam when you ask about the recreational drugs or ask about the female history, you ask it normally. You are not saying, we are not signposting by saying sorry. We are asking this question normally.
Okay, this is because of yeah,
This is normal.
different culture. Yeah, different culture because they have a lot of
Yes.
relationships, a lot of recreational because but for
Yes.
us it's yeah, something which is sensitive.
Yes. But Reeve, no, we are not saying sorry for that
They are not sensitive to that.
at all.
Simply.
That's why I'm asking.
No, try to make
No.
it. But
Yes.
also in your case center, I guess they will accept it.
Yes.
Anyway, just show them. It's a matter of show how to show the exam that I am taking care of the welfare.
Yes. Okay.
Okay.
Yes. Okay.
Any other question? Dr. Khalid also add another antibody, anti-gladine.
Okay.
Regarding the previous case, when you ask for the birth control pills and relation to the irritable bowel syndrome, yes, there is risk of having thrombosis or thromboembolic event with irritable bowel syndrome due to
Even with
okay.
only any admitted patient with irritable bowel syndrome, you should admit him on some of prophylaxis, even
Yes,
if he's not taking combined pills. But
exactly.
if
Yes.
you search about the drug contraindicated, you will find combined pills. I have one patient today. She was having Crohn's disease, and she was having an IUD, so she's having bleeding, and she was having cramps. So she was telling me, I have this cramp. So because this cramp, because I'm not allowed to take ibuprofen, and I'm not allowed to take combined pills. So
Mm-hmm.
to remove this IUD. So I got it from the patient. So they told them from the beginning, since long time, non-steroidal anti-inflammatory drugs are contraindicated, and the combined pills are contraindicated. So that's
Yes.
why I didn't know before that in Crohn's disease any medication contraindicated. But when she told me today, I couldn't take ibuprofen and I couldn't take non-steroidal. So I told her first time I know this, and then I check on
Yeah.
I found it. Yes, it's right. So
Yeah.
I think
So
this,
it's
yes,
thromboembolic. Yeah, because it's already thromboembolic and the disease itself is thromboembolic
yes,
risk.
yes,
Plus the non-steroidal, whenever you have patient showing you non-steroidal in his medication list, you have to ask him, is it by medical advice or just over counter? If he said no over counter, you have to give advice because you know the non-steroidal side effects are much common than the benefit. Yes, it
yes,
regrets the headache, it
mm,
regrets the pain, but if he
mm,
took it for none reason, it will
yes,
be risky, not beneficial. So
yes, you're right.
you have to advise him. Is it by medical advice? Yes. Okay, you know how much you are taking per day, maximum dose, whatever you want to advise. Just touch this point fast. It will
Okay,
give you good mark for the welfare.
okay,
Non-steroidal is not medication to be prescribed forever or for lifelong. Should be for a reason and indication, strong indication because of the side effects. We have patient here, very young, admitted to the ICU for pulmonary edema, and when we reach to the cause, she had kidney failure because of the use
non,
non-steroidal anti. Yeah, and she became now in the stage renal disease patient in her 30s, which is
yeah,
very weird because of
yeah,
the use of
non,
non-steroidal anti-inflammatory for a long time. For what? Toothache. Imagine toothache. She's taking non-steroidal
mm,
until it damaged the kidney. So
you're right.
please, yes,
Mm,
take care of this medication whenever you find in the patient in the medication list. Give
mm,
advice regarding it.
yes, you're
Okay.
right.
Yeah.
Thank you.
Apart from this, you did great than before.
Thank you, Dr. Bess. Thank you so much.
Most welcome. Most welcome. Any question, Dr. Sarah, Dr. Abdullah?
Yes, thank you. Just
Most
as
welcome. Oh,
the workup,
yeah.
yeah, for celiac disease, as you mentioned, the most specific test is anti-trans glutamate antibodies, and you need to test for IgA level for to do the test, and you need to put the patient on a gluten diet.
Right. Yes, only
for
in the
2 weeks, for 2 weeks before to do the test.
yes.
Okay, and then when you want to take the biopsy,
Also with
the finding والاثنين containing that and the expected findings total بالله سطر فيها.
Yes.
Okay, in the biopsy.
Yes, you can mention it. But
Then other
what
workup that for iron profile, vitamin B12, folic acid levels. Also, you need to do investigation for complication, risk factor for osteoporosis.
B12 and folate, yes, you're right.
Mhm.
Yes,
And calcium also. Calcium,
yes.
vitamin B,
And also,
folate,
Yes.
all minerals, yes.
That's right.
Malabsorption there.
yes, yes.
Yes.
Yeah.
There's
Thank
also
you.
most,
Any reference
Sorry?
regarding biopsy? Any reference, duodenal or jejunal?
duodenal, yeah,
Or
yeah,
cancer?
Duodenal.
Duodenal. Yes,
duodenal.
duodenal.
Yes, duodenal.
Lymphocyte also there. Villus atrophy, yes. You can
Well,
find both. Yeah, very important point in the celiac. It might be associated with lymphoma.
Yes.
Yeah.
If
This
he asked,
increase the risk of lymphoma or malignancies, lymphoma, gastric, and
yes,
other
Yes. And
colorectal
also Hashimoto disease and celiac disease,
yeah,
both of them can
excellent.
the risk of lymphoma.
association.
And
So for
another
the concern,
Sjogren also.
yeah, for the concern of cancer, yes, you can put it and you can give his advice. Red flag
Yeah.
also can give if you have a loss of weight, significant, and yeah, in the communication scenario or even in this patient, if you have time in the consent.
Okay.
Yeah. Okay. Thank you, both Dr. Abdullah and Dr. Sarah. Anything else, Dr. Abdullah, you want to add? Yes.
No, thank you. There's
Thank
some
you.
certain criteria, and you mentioned it. Yeah, it's
Yeah.
just family history of cancer in two members.
Yes. Second generation.
Two consecutive, two generations, and
Mhm.
3 family members.
Yeah. And death less than 50 years.
Less than 50 years, yes, exactly. One member is less than.
One family member died with less than 50 years,
Oh.
and family history of first degree or two in second generation. Okay, clear, great. Thank you all, Dr. Abdullah and Dr. Sarah. Let's move to the communication. Dr. Khalid and Dr. Aisha. Sorry, Dr. Abdul Minam and Dr. Aisha. Ready? Any other question before moving to the communication?
Yes, Dr. Basim was differential here. Also, we need to give advice regarding alcohol intake.
Yes. Yeah, I
This
mentioned
is
it. There is some gluten-free alcohol, like beer,
Yes. Okay.
but also within the social limits. Okay?
okay. Regarding also concern and explanation.
Mhm.
Also, we need to mention team of care like gut doctor,
Yeah,
like
good
this
point to
for
raise. Yeah. Thank you to raise it, Dr. Mahmoud. Yes. Actually, I wanted to give advice regarding this. Whenever he asks you something which is not related to your specialty, Dr. Sarah, you can say multidisciplinary team approach.
Yes.
He
Okay.
asked you for the camera scan, and you said, yes, I do, I could do, I couldn't do. So better to say, yeah, our gut doctor will help us in this decision.
Yes. Because usually
Okay.
it's not the job of registrar to take the decision to do the camera, but the consultant is taking the
Yeah, yeah. Knowledge-wise, better to say this answer. Yeah.
yes.
Dr. Farah, this depends on the scenario. If in the scenario written, you are the doctor in yeah, in GI clinic. Then this is your role. You are the one who will decide. And for upper GI endoscopy, you get my point.
Yes. Okay.
And also this difference from in communication, it differs from long clinical consultation. In long clinical consultation, yeah, you can mention that you will involve the gut doctor, but here when it indicated, you should mention.
Mm. Okay. Thank you.
دكتور عائشة، دكتور عبد المنعم ready?
ready إن شاء الله.
Who will start?
What do you prefer, Dr. Aisha? Start or you're going to start?
Dr. Aisha, we can't hear you. You are on mute, but no sound. Okay, Dr. Abdulrahman, until she solves this problem, can you pause the case and let her start after fixing her problem?
My voice clear right now?
Yes, Dr. Aisha, you will start first. He will post the case. Yes, the case is here. Mr. Brandon, 60 years old patient, was referred to by his GP with abdominal pain, jaundice, itching, and weight loss. Admitted to the hospital for further treatment. CT confirmed cancer pancreas with mets to the liver, local spread, biliary obstruction. Treatment team or treating team decided the cancer is inoperable. As a part of his palliative care plan, he is undergoing ERCP to relieve the obstruction. Talk to Mr. Brandon. Wife, explain the situation and address the concern. We'll give you 2 minutes.
My voice clear, yes?
Sorry?
My voice clear or still?
Yes, clear now. Yes, clear. We
Okay.
can hear you. Yes, 2 minutes, then we'll start.
Okay. Okay, you can start.
Okay, let's.
Okay, hello, I am Dr. Mitwalli, one of the doctor here on the ward. May I confirm you are Mrs. Brandon, wife of Mr. Brandon?
Yes.
He is 60 years.
Yes, doctor.
We are here, Ms. Brandon, to discuss about your husband's condition, and I suppose you are the next of kin of him.
Yes.
Mhm. Okay, Ms. Brandon, can you tell me how much you know about your husband's condition to be in the same page?
Yes, my husband just started to complain this. His eyes were changed to yellow color, and I have noted that he lost some weight recently, and sometimes he feels this itchiness in his body. Then we came to the hospital and we did, I think, the doctor asked some tests, and here we are in front of you, doctor.
Mhm. Okay. Ms. Brandon, with the scan that he did, I have the result in front of me, and I'm sorry to tell you that it is not good as we hope.
What's going, doctor? What's going on?
I'm sorry to tell you that the scan of the tummy demonstrates that he has cancer in his pancreas.
Oh my goodness, doctor. Cancer? Oh my God, doctor. So he's going to die soon, right? How I can help my daughter? She wait us in the house at home. We told her that we just will go to the hospital for a minute and come back.
I'm really sorry for this bad news today. I supposed to explain you more about the condition, really, Ms. Brown, if you desire that.
Surrogate still crying.
Okay, I'll offer tissue for her.
Still crying.
Okay. Are you willing to continue our talk, Ms. Brandon?
I'm okay. So, doctor, so he's going to do surgery soon?
We will talk about that now, Ms. Brandon, if you let me. So, Ms. Brandon, I have another something concerning need to tell you. If you need anyone to attend this meeting with you, so we can support you also.
No, doctor, I'm good.
Okay, we found unfortunately that the cancer in his tummy is like spreading to other places apart from the pancreas, like part of his liver. That is cause for him this manifestation that he come for, that he close something in the liver that producing this yellow material that is accumulated in his body and causing him this yellow discoloration and itching, and also causing him this tummy pain. Are you following me, Ms. Brandon?
Yes, doctor, but still I didn't understand how you are going to treat him, doctor. So is he need to do a surgery or chemotherapy or what?
I appreciate your concern. I'll explain to you more now. The team is revised your husband condition, and they decide for him that he the cancer we can't remove it at all, so we can't cure him from cancer at this stage. I'm sorry to tell you this news.
What do you mean? So you let him die?
No, absolutely no, Ms. Brandon, and I'll explain our management for that. The team decide for your husband right now. we decide for your husband one management care calling palliative care. Do you have ever heard about this term?
No, doctor, what is this?
This palliative care, it is one special management we give him to a patient, to the ones that we can't cure their disease completely, but we can support them at the end and to improve the quality of for their life till the end, and making them live comfortably and in good in the as much as we can in good state.
Mhm.
Are this is clear? Yeah, this team including some like members like vein doctor and the gut doctor, and also can including mood doctor and dietitian for advice. It is like a group of members that is doing together for comfort of your husband, and they will giving him the much care and the much comfort and quality of life to till the end. This is sound clear, Miss Brand?
What do you mean by till the end, doctor?
I'm sorry to tell you that this is cancer because it is spreading too much, and no cure. Any cure we found by discussing his condition, it will progress, and nothing we can do. Just we can support him and giving him much care to be not in pain and to improve the quality of the remaining time in his life.
Do you think he is dying, doctor?
Sorry, again the question.
Do you think he is dying?
I'm sorry to tell you this is the type of cancer usually will not live for long time. We are talking about maybe months, maybe more. It is different from one to one.
Okay.
So, Miss Brandon, we need to do some procedure for your husband to just relieve this yellow discoloration that he suffers from and itching, and to relieve this his tummy pain, so he can eating good, and this is like just for his manifestation, to improve his manifestation, and as we talk, to improve his quality of life. This procedure is called ERCP, and don't bother about this name. It is like procedure we did like camera test from his mouth and send back to his liver, and especially the organ that I explained to you that is collected the yellow material. If I can draw for you, if you need more explanation, Ms. Brando.
Okay.
This is our liver, and there is some sac inside it. It's collect the yellow material that we use it in digestion. In case of your husband, this is the close of this pathway and passage of this sac, and we will resolve this passage by this procedure. So this will done in here the best for his interest, and is this most appropriate step right now.
So, doctor, is this procedure cause a lot of pain? Because I'm afraid we cannot tolerate that.
I appreciate your words, but I assure you that it's done under like numbness material, that he will also be sleeping during this procedure, and he will not. We will keep him free of pain as much as we can. I need to ask you if you need any support.
Doctor, do you think he? Doctor, you already told me that he is advanced stage of the disease. Do you think he is able to tolerate this invasive procedure, doctor?
Really, this is discussed about the team of management of your husband, and they decide that will improve his quality of remaining time of his life, and it is done for his best interest right now, and they expect that he can tolerate.
Okay.
Okay. Do you need any support at home? Anyone dependent on Mr. Brandon?
Yeah, I live with him and I'm take care out of him, doctor.
Okay, if you need any support, we can include the social worker. They can explain, you can express your wishes and struggle, and they can help you.
Okay, time is up.
Okay.
Thank you, Dr. Aisha. Well done. Let's hear the comment from Dr. Abdulmanem and prepare his scenario, please, to start immediately.
Okay, well done, Dr. Aisha. But I want to stress the point. When you are breaking bad news, almost always the surrogate give you a concern. You should pay attention for it. Please pay attention when you're breaking bad news. If you hearing well, I said, sorry. Okay.
Yeah, go ahead. Go ahead.
When you break the news and you told me that he has CA pancreas, I immediately after crying, is he's dying? Our daughter is waiting for at home. So this is a concern. Don't overlook it. And almost always the surrogate at this point give you a concern. You should be full attention for this point. Another thing, your task is to explain ERCP. So if you read the scenario as a part of palliative treatment, so here in palliative care, you just give us a brief definition about the palliative care. It is a part of treatment that not intend to cure the disease, but improve the symptoms or improve the quality of life. Your main task is ARCP. You should approach the procedure, approach for the procedure. Why we
But
need
why
it,
I'll
how
explain
we
for her
do it.
the consent for for his husband.
Not consent. Here yes, you are talking to the next of kin of him. So Mrs. Brandon, after that we will set another meeting with you, and because here you don't have any idea about the capacity of Mr. Brandon, so you cannot offer the consent, but you will mention this. After that, we will arrange another meeting with you and Mr. Brandon, and he, if agreed to do the procedure, we will give him informed consent, for example. But she is the next of kin of him, and by the way, she is his wife. So I think even no need to ask her if she is the next of kin of him or no, because she is wife. So regarding the procedure, you should explain the full procedure. So why we need it, how we do it, who will do it, and before, during, and after, and the complication, and so this is the main task, is the explanation of the procedure. You took a lot of time to explain the palliative care treatment because I think you waste a lot of time in palliative care treatment. And in spite of that, this is not main task. The main task is to explain ERCP. Because there is no time to explain for breaking bad news and palliative care treatment and ERCP as a procedure. So, okay. This, yes, you mentioned point that until the end. Immediately, if you discuss this point, immediately expect that surrogate will give you a lot of concerns. Is he's gonna die? He's dying, blah, blah, blah. So I think there is no need to mention this point. You will give him support until the end. Even this can cause, even the surrogate might cause crying until the end of the station. So avoid these words as much as you can until to the end, until to his death. Especially, this is not end of care, end life care. It's a palliative treatment. So no need to mention that until to the end. Because if you mention this point, you immediately can expect a lot of concern and patient will cry again. And you will waste a lot of time. This is my comments on this. If anyone has another comment, I finished.
Yeah, thank you, Dr. Abdullah. Dr. Abdullah. I will comment only on your comment before commenting on Dr. Aisha. The wife, you said the wife always the next of kin. For me, I disagree for this point. You can't assume that he might be the son and the wife living away from him. So the best thing to ask, are you the next of kin? Don't assume. Because when you have decision, you have to take it from the next of kin, and she might not be the one next of kin. So you have to ask her. This is regarding the point of wife and the next of kin. For Dr. Aisha, she did well. Before commenting on Dr. Aisha, please, the scenario is down, Dr. Abdullah. You can read it until I finish the comment. Prepare
Okay,
yourself.
one last point. I think
Yes.
did she need to mention LBA or advance directive or no?
If palliative, she can say about his living wish and advanced directive. Yes, she can.
Yes.
So this is palliative
But if
therapy.
to the patient, I think to the wife also not be suitable.
Yes.
Or if I have time, I can advise, just
If you have
advise here.
time.
But I think no, يعني, it is for the patient. Here also, if it is he is aware, I should ask. If not a next of kin, I should ask here. I suppose that your husband is happy about know about our talk. I think this is a question we should
Not
suppose,
happy.
or
Don't say happy. Yeah, don't say happy. He will not be happy at all. Yeah, he knows
just
about
about
our
the talk that
permission.
he is okay, or he know about our
Yeah, but
talk.
you said
Yeah, just,
you said happy, right? Or I heard it wrong.
it is just
He
a
had.
term to relieve that is
Yeah, it's a term, but it's
he
a
is know
feeling
about
also.
that, and he
Yeah,
is
it's so
willing
better
to
to
hear
say
to know
no.
about his condition.
Yeah, better to say no, not happy to.
Okay.
Okay. Regarding the palliative, yes, try to be short in the explanation of palliative because you have the main
Because
task
I don't
about
know
ARCB.
specifically what is the
Make it
scenario.
very
They didn't
short,
mention what is the rule or what you will do.
but the task is
And I
clear,
suppose
Dr.
that is a
Aish.
procedure I not explain to the next of kin. Why I'll explain the procedure to the next of
So
kin?
why
He will
it's
not
written in the
consent
scenario?
about it. It is written, but he not written that is this is the rule.
Why it's written as a task and not to mention it? A
Explain
part
the
of his
situation,
palliative
just the
plan,
situation. It is the situation all. So the most important thing is the breaking bad news and what is going
okay,
on.
breaking bad news, palliative,
Yeah.
and this procedure. Even
Yes,
she will not.
procedure coming late in the discussing, and I think no need for details for procedure for the wife because she's not the one who will sign the consent.
You need,
This not the one who will having the
Even
procedure.
yes, you need
what?
to explain anything in the scenario. This is your task.
Why
Sorry,
not? I don't know why you are not accepting this, Dr. Aisha. Patient
sorry,
wife will know,
Dr.
even if she is the one not signing the consent, she should know what will happen with him
Why she
as
should
next of
know?
kin. Next of
Yes, she
kin.
should know the situation, but the details,
But
every details over
right,
the procedure.
Comment.
Dr. Aisha,
Dr. Aisha, she is the
ARCP
next
is
of
one
kin
of
of him.
Yes, I know.
ARCP
Yeah,
is palliative treatment here. One
I
of
already
palliative.
explained, but not on full detail like the patient, like consent
you can
to
say
take consent.
you can say in very simple way because anything related in scenario you need to address it in this.
Yes, I already addressed it and talking about it.
In,
But it is the problem here. They said I should not talk about the palliative and I talk about
no,
the ERCP more.
consent is one of
Mhm.
the palliative care. You can give palliative chemotherapy, you can give palliative chemotherapy, or radiotherapy. So you will say only we will among one of our palliative care to relieve the symptom because he has this yellowish discoloration and because he had some secretion in his liver which are blocked.
This is the thing I said already.
Plastic juice to relieve to make the body get rid of these secretions and to relieve the symptoms. Only you don't need to draw, you don't need to take all this time. Only like this, a simple way explanation in 1 minute. We will.
Yes, and that is what I did. But they need me to explain the procedure, the pros and the cons and the side effect and how
No, no, no,
it
no,
is well done.
no, no,
I
don't
no
Yeah.
time for that, and I suppose from scenario that is they will not
Dr.
let
Aisha,
me
just
know doing
No,
that
don't
for
need to
yeah.
take
you are
consent. Don't need to say the complication or all these things. No, so you will tell him. They will do, and even if you are requesting the RCP, we will tell the patient and explain for him. But this, it's not written in the scenario. It's mean in this scenario. I think that this one of the palliative care to relieve the obstruction and the jaundice by putting a plastic tube. You say I will put plastic tube to relieve the obstruction and make these secretions go down and get rid from the body and finish. Don't say there is no time to say about side effect of operation or all these things.
But they have another point of view. This is what I did, but
Yes,
they have another point that I should explain it in details. Yeah.
I think this
Okay.
it's only 10 minutes, so you won't have time. And the patient will talk a lot and will say a lot of things. And it's not written in the scenario to explain the side effect of procedure. You will explain it only.
Any other comment?
I just want to say regarding the question, because usually they're asking, will he die? So we can say this is a difficult question to answer now, but his cancer is spreading. So it means that when this cancer is spreading, it means that he's won't survive for too long and finish. First, or say this is a difficult question to answer, and don't say for few weeks, few months, few years. Only the end of life care you can say it, because the end of life it's about few days, okay, to keep the patient for the end of life. But the palliative care he can may live for many years. So you can say it's a difficult question to answer, but the only thing that I know now and I want to tell you about it, that this cancer is spreading. It will affect him, but I don't know when exactly he will die. This is a difficult question to answer.
also, Dr. Basim, I have comment. Dr. Aisha, you did well, and in the exam setting, there will not be a lot of tasks. Yes, you are right. Here in the scenario, there is a lot of tasks, 3 tasks: breaking bad news, explanation, disease, and also procedure. The exam setting, when you ask the patient, most of most of the time he will be aware about the disease, and then you will jump to your task. Okay. The other thing that in the scenario, the information not mentioned in the scenario, uh, don't mention this like Dr. mentioned for days, or unless it is mentioned in the scenario. This will be for expected for months or days. You need not to mention it. Just you can answer by this will shorten his life. This is a suitable answer.
Yeah.
And
Yes, you're
also,
right.
if you draw, this will uh, save time for you. Why? Because by drawing, you will explain pathology, you will explain the complication, and even the procedure. It will be easy. Just we will put a tube which you will relieve the obstruction, and this will help more. We can arrange. You can explain the procedure generally, and then you can say we can arrange for another meeting, consultant, and to do to explain for you and your husband more and how the concept. That's all.
Yes.
Okay, thank you. Yeah, regarding the point of how many days, as Dr. This is for Dr. Sarah also to be more diplomatic in the answer. As Dr. Abdullah said, the cancer nature make or shorten the life of the patient. For how long? I'm afraid to say I can't detect and I can't say specific or particular time. But actually, I'm afraid to say the cancer shorten his life. That's it.
Yes,
If end of
it's a
life
good
care,
answer.
yes, yeah,
Yes.
end of life care, you can make it minutes, hours, because he will die, and you have to be honest. End of life care is different. You might finish the meeting and the patient will die. So
Yes.
end of life care will be like minutes to maximum hours, maybe days, but it will not exceed days. But
Yes.
palliative could be from day till year. You might live longer, you don't know.
So for the end of life care, usually we are transferring the patient to a side room and ask the family to be
Yeah, family to stay with him. Yes.
not eating, drinking. They give only snip of water. Sometimes giving the IV fluids. So
Yes.
it's matter of days that he will die. So when we found
Maybe less.
life care, after 2 days the patient died, or even 1 day.
Yes, exactly.
So you encourage in the end of life care, you want to ask someone of your family to come to visit him, anyone who's caring about him or loving him, so they can come to see him.
Yes, exactly.
السلام عليكم. تعقيب أخير بس بعد إذنكم.
Yes, sure, Dr. Karim.
Yes, because I'm I'm an oncologist and I'm working in the pancreatic cancer actually.
Okay,
So I'm
good.
facing these cases like every day. So
Okay.
usually in asking about the prognosis or life expectancies for especially cases in advanced stage, we are saying like this cancer tends to be very aggressive, but we will do like our best, try to control it as much as possible and improve his quality of life. This will be like by palliative team, which including pain management, specialist nurse, social workers, and like that. Because palliative also not like end of life care could include palliative chemotherapy.
Yes, and radiotherapy, yes.
So it depends. Like it's too early now to say when he will like die or like that. We need to like fix the first problem, his biliary obstruction, by the ERCP, which are doing this to relieve the obstruction in his biliary channels. Then after that will be discussed like in multidisciplinary team, including a surgeon, including oncologist, including palliative team, and will determine the plan of management based on his condition at this time. يعني كده in brief يعني.
Yes.
Yes, great answer. Thank you, Dr. Karim, for
You're welcome. Thank you.
clarification. Yeah, thank you. Any other comment before going to the next
I
slide?
have a question, Dr. Basim. Thank you,
Yes.
Dr. Aisha. I think she did well and great. Here, patient competent or no? How we can know? Because here, Dr. Aisha invite someone to attend this meeting. Also, before this, also we need to know expectation of the wife, because this is a very bad news, to prepare her well.
Yes, I agree for both comments.
Yes, you
or
are
for
right,
both
Dr.
questions. Yes,
Yes.
you can do. To be
But
more also sure.
how we
Yes.
can invite here someone to attend this meeting?
Yes, this is wrong,
We
yes.
are not sure about the capacity of the patient. Suppose
Yes,
here,
yeah.
if not mention capacity in scenario,
Exactly,
we
yes.
assume patient as competent.
Yes, if not mentioned, he is confused, drowsy, and coma, assume he is competent. So you have to get his permission.
Yes, you're
Or
right. Yeah.
not to get to assume that you got his permission to talk about his condition. Especially you are talking to a surrogate. I mean, someone presenting him or presented the meeting, not him. Assume
Yeah.
we have permission from the husband that to talk about his condition. That's it. Okay.
Yes.
And the other point also accepted.
I think when you are saying are you in, it means that he has permission.
Yes, but you have to mention it to show. It's a matter of show, Dr. Sarah. All the exam is
Because usually I'm not sure saying are you next to do the
yeah, this question is important because of the decision. If there is procedure or even the rules, you have to get or to assume that you are the next of kin for him.
okay.
Okay. Try to make it as introduction. The patient name, the age. If the surrogate, you can ask if we get permission from the patient to talk about his condition, and are you the next of kin? Then
But
what is
not written in the scenario you get permission from the patient, so you can say
no, it's assumed. Yes, you can assume. I assume we get permission from your husband to talk about his condition because this is one of the confidentiality. Why you are talking to the patient? Why? It's a show the examiner that you got the permission by assume, and we are proceeding after the consent. or after the approval, I mean, not consent, approval. Okay, so you have to assume that.
Yeah, even if written in the scenario, yeah, you can tell like that. You
So
can tell,
how
yeah, we got the permission from.
permission?
No, or you
Yes.
can say, I assume that.
Or you can say, can I ask you if you have permission from your
No, don't ask. If you ask means you give her the option to say no, I don't have. So if she said no, what you will do?
Okay, I believe
So yes, I believe we got a permission from your husband to talk about his condition.
okay.
Don't ask. And also,
Yeah,
I
and
want to.
and if you ask, then it will tell that you.
Sorry, doctor.
If you ask, that means that you are not trusting your scenario. This is the
Yes,
problem also.
exactly.
Don't
So
ask, just
assume.
tell
Don't.
that.
Okay, one point also for Dr. Aisha when she said, "Will you are you willing to continue the meeting?" If she said no, I'm not fine, you'll be in trouble. So you can offer tissue, you can offer water, then proceed. Go ahead. Tell her, "Are you okay now? Shall we go?" Yes, go ahead. But are you willing to continue? Maybe she'll say, "No, I am not okay, doctor." Don't offer this question at all. Clear?
I don't know how to interrupt this drama. Yeah.
We all don't know.
Give her water. This is tissue. This is water. You want some water? Yes, doctor, please. Offer her the water. Maybe on the table some water, and it will be also good for your.
But I should excuse her to continue the talk. Yeah. I not
Yes,
interrupt
you will tell
this
her.
by
You'll tell her.
talking
Are you
about the
okay?
disease.
Yeah. Are you
Yeah.
okay now?
Can we continue? Yeah.
Yes. Are you okay now? Yes, I'm okay. Go ahead. Okay, but are you willing to continue the meeting? Yeah, and she might tell no, doctor, I'm not feeling well. So you will stay quiet for more, and the time will be also wasted. This is my opinion. Yeah, Dr. Abdul was dramatic little bit or more. Okay, let's start the second scenario. If you, yeah, Dr. Abdul, you ready?
Dr. Bassem, just I need like 5 minutes. If we can proceed after 5 minutes or postpone for tomorrow, as you like.
Yeah, I guess let's make a vote if all of us can wait or no. Is it late for you? Shall we wait or postpone for tomorrow?
No problem. No problem.
Okay.
5 minutes or postpone for
Okay.
tomorrow.
As you like, if you can, all of us, no one said no objection. Okay, we'll wait for you.
We'll
Okay,
wait for
5 minutes
Dr.
only.
Manal.
Okay,
Sorry?
thank you. Less than 5 minutes, inshallah.
Okay.
I'll just pause the record till you. Okay, are you ready, Dr. Aminan, to start the case?
Yes.
Okay, Dr. Aisha,
Okay.
let's
I'm
go.
here.
Hello. Hello there.
Hello.
My name is Dr. Ahmed, one of treating doctor in the clinic today. Can I confirm that you are Mr. Jones, 35 years old?
Yes, I am.
Mr. John, we are here today to discuss some issues related to your health. Is it okay with you?
Yes, doctor, please.
So, before we start, can you tell me how much you know about health status?
Yes, doctor. I think I know more than the doctors. That is, I have 5 years now. I am suffering. I have bad headaches, and I keeping taking a lot of medication. And my GP told me always that is difficult headache, and that I have something called white coat hypertension. And he prescribed me a lot of medication about that. And finally, when I come to him, he said, I need to follow up in your clinic. And when I come here, they doing some test and scan, and they said to me that I have some problem in gland above my kidney, and I should have like surgery in the near.
Okay, Mr. John, I am so sorry about it. You have been through, I believe that you passed through a difficult time, and we are here for you and to help you.
Okay,
Mr.
doctor.
John, Mr. John, do you have any specific concern or a specific concern?
Really, doctor, I need more explanation about what happened, and I put in my mind some negligence in my condition.
I highly appreciate your concern, Mr. John. If you allow me, let me explain to you your situation. As the doctor explained to you the problem that in your the problem in the gland above your kidney, this can cause symptoms just similar to the hypertension. So because this gland above your kidney, because overproduction of a specific protein called catecholamines, actually they have similar symptoms as well as the hypertension. So your concern is valid, Mr. John, but I would like to I would like to explain that because I'm not in the position to defend my other colleague, but the point that from the start might have the same symptoms, this including headache or other symptoms that you have. I hope you understand this point, Mr. John.
Okay, doctor, but really, I need your to be honest with me. Do you think that this is the circumstances here that there is no anything missed from my GB, and all these 5 years he didn't think about anything causing this high blood pressure?
Okay, your concern is valid, Mr. John, but I'm not sure that what the doctor see at that time, but at least let me to contact with him and to see what he said at that time. Then I will make another meeting with you and to explain and give you my opinion about this regard. I hope you understand this point, Mr. John.
Okay, doctor, but really I need to raise a complaint. I really suffered a lot, and I need this to be investigated in a proper way.
I highly appreciate your concern. This is your right, Mr. John. And if you would like to raise a complaint, they will ask for expert opinion, and then they will analyze the situation and they see if there is an error or no. Even if the result of this expert team, even you are not even I mean even the team that says this is not a complaint, this is not error, you even can sorry for that. I mean they will ask about opinion, and they will see if there is an error or no, and they will contact you again. I hope you understand this point, Mr. John.
Yes, this sounds good, doctor. So you can you help me and guide me how I can make this complaint?
Yes, I will guide you. This is your right. I will guide you to complaining office, and as we have discussed, they will seek for expert opinion on this regard.
Okay, doctor. Thank you.
Do you have any other concern or specific point you want me to repeat?
Really, doctor, I need to explain for my condition, that is this surgery that they tell me about. I'll be cured after that.
Well, I highly appreciate your concern, Mr. John. Regarding this situation, in many cases, and the majority of cases, this growth is a benign growth. What I mean that usually after the surgery, they have a cure from the disease. But after the surgery, they will take a snip from this growth and they will examine it under the microscopy. and depends on this result, they will tell you about the overlook of your condition. Is it curable or no? I hope you understand this point, Mr. John.
Yes, doctor. So there is any possibility to be a cancer?
I highly appreciate your concern, Mr. John. There is a small possibility to be a cancer, to be honest with you, but at the same time, the majority of cases in similar to your cases will be benign and with no any nasty growth. I hope you understand this point, Mr. John.
Yes, doctor. So am I expected for how many days I be off of work for this surgery?
Sorry, again? Sorry?
What expected time I be out of work for this surgery?
Well, Mr. John, regarding this, this matter will be discussed with the surgeon who will doing the procedure. But also they involve occupational doctor, and after discussion they will give you a suitable sick leave for your work. I hope this help you, Mr. John.
Okay, doctors. Okay, this will be good.
Okay, do you have another concern or something you want me to repeat?
No, thank you.
Well, Mr. John, I want to assure you this procedure will be done by very expert team, and you will be in the safe hand. And this procedure has been done many times by our expert, and we are here to help you if you need anything from us.
2 minutes
doctor.
left.
Thank you.
Okay, Mr. John, may I ask you, do you smoke?
No, doctor.
Okay, let me just 1 second. Sorry. Sorry. Yes, Mr. John. Let me appraise you. This not be smoker. This is good for your health. Do you need for what is your job?
I am accountant, doctor.
You're accountant. Okay. Do you need any social support, or are you financially supported?
Yes, it will be no problem, doctor. Just this is days that I will be off of work. I need to explain to my employer about.
Okay, as we have discussed, we will involve social worker and occupational doctor.
Okay, this will be good.
Okay. Do you have any other concern?
Thank you.
Well, Mr. John, I will give you website videos to give you more information and about the procedure. At the same time, I will at the same time, if you need any help or any from our side, we are here. We are happy to help you.
Okay, thank you, doctor.
Thank you for talking to me, Mr. John.
Thank you.
Okay, well done. Let's start the comment, Dr. Aisha.
Okay, well done, really, mashallah, Dr. Abdul. Really, I didn't find a comment, but mashallah, you explore good point, and you making it like uncertainty when he come to a point to advise if you are sure about there is any mistake or negligence or no. So about if the mistake is out of hospital, you can't raise in instant report. You can't, even if you are sure about, you don't know about the circumstances, so you should investigate and just say that we will contact the GB, not I will contact. You can say like by team word. We will contact the GB and accept to be to know about the exact situation, and we will inform you about what we talk about. And as you said, you can guide him if he insisted about the pulse office, and they can advise him how to raise a complaint for the GB. And you will also just mention at this time that I really will be beside you, and be sure that your complaint will not affect at all our management plan and our maximum care for you. It's just one point, because they will need to hear this from you, because it will justify the justice in the ethical point of view. So just if we guide him, if he insisted, his right, and just mention this sentence. It will not affect at all your management plan. After that, you explain that there is a lot of diseases similar to others in the manifestation, and also you can mention this is some rare condition that is not facing a lot. It is not common as the conditions that you diagnosed as the white coat hypertension. So I am not defining my colleague, but is really missed easily, because it is similar for other conditions that is more common than this condition. But really, I don't know the exact situation, and I'll investigate and come to you by another meeting to explain more. For the disease, when you can also, when he tell you that they diagnosed you with something like that, do you need any explanation? Because I am the one raised the concern, but you can ask. Do you need any explanation about your disease? They tell you everything. I suppose they tell you everything about the disease and the management plan. He can raise some concern like that he said. It is this operation, this surgery, doctor can cure me. Is this the cancer? And you reply this with good response, but just the word benign, maybe not common, or maybe not all the ones be like know about. It can be not, it can be jargon or no, but I don't know. But just if you can not explain, like, it is like we in most of cases this can cure, because it's not a cancerous condition in most of cases. And if he ask, and we will raise as we will take SNP and making some test for it. If he is why you will take SNP, doctor, it can be cancer. Yes, you will be honest, and I appreciate your worries. I'm sorry to tell you this is a very minor percent that can be cancer. And we can't expect that right now, and I'll just reassure you after the proceeding by this surgery and SNPs that we will take. Just as finally, you have that, like some second at the end, you can just explain, offer a brochure about the disease or about the problem with the disease, like that. You can also giving warning symptoms for this patient when you end, if you have time, just because maybe this scenario not a lot of talk in it. If you have time, just it will be, this is two possibilities to offer brochures, and also to explain some warning symptom. Please let us know if you have severe headache, severe like your conscious level be different from the patient, or if you have like sudden severe headache, you should contact. I'll provide you with the contact number of the hospital. You can call at any time to take any advice, or to if you need any explanation more. This is all.
Okay, thank you, Dr. Aisha. Well done, Dr.
Thank you so
Abdullah.
much.
Yeah, I have comments, and it will be a big drama after this comment. It will happen because from my side, this is an error. This is my opinion. I don't know. Maybe someone will say no, this is not error because similar condition. Yeah, but since this patient suffering from hypertension for 5 years, and he went many times, investigation, everything done, and still he's not diagnosed as pheochromocytoma, for me, I will deal as error. For 5 years, he should be
The
diagnosed.
difference, Dr. Bassem, is this is out of your institute. This is not in a
Yes,
hospital.
there is criteria, Dr. Bassem, for
Yes.
secondary hypertension to be expected. It is like the age and how many visits he come
But
and what
yeah,
is the
but for
symptoms
the
he
duration,
has. And if you don't have any very high blood pressure at the visit, you should suspect about that. So it is a specific criteria, and this is not specialty of us. There is should be expert will decide that. So if he insisting about negligence, you just as Dr. Amniniam said, he is uncertain about the situation. Maybe he visits through these 5 years 2 times or 3 times, and all the times do not have malignant hypertension, very high hypertension, and maybe the electrolyte was normal. So any suspicious about, and maybe have some really symptoms, other symptoms of anxiety, and he complain about anxiety. So the doctor is right about thinking that he has white coat. So you don't know the circumstances. And also the secondary, maybe you should refer from the start if it is like before 20 or before 30 and not controlling on medication. There is specific criteria. So just touch to your scenario. If they didn't mention error and anything missing, you just will be with the scenario. Trust your scenario. And if the patient have more concern, you will deal with an uncertainty. You don't know really. You don't know if what if he visits through these 5 years 2 times only or 3 times only. What if his blood pressure is clearly controlled, not very high or not very suspicious? What if the electrolytes was normal? Not all the patient of peritoneal come with malignant, and to be specific by, the medicine, no single is a rule. Many symptoms will be different for patient to patient. Many manifestation can be different. This is not we trying to fix, but it is no anything like we study at the same by strict way.
yeah, okay, I agree with what you said, okay? But let's make the
but
things more
it's
clear.
still
Sorry? I will say this comment, then I will receive the question. If the duration less than 5 years, I am agree 100%, 6 months, for example, or 1 year. But for 5 years, he will go to the GP for 2 times with high blood pressure, with less symptoms, no headache, no sweating, no shakiness. This is first thing. And let's make the things easy. The scenario will be written as either medical error, so you will have the title up, medical error, or it's not medical error, they will say uncertainty. This is assuring news. I'm saying that because I saw that my eyes. They will write the title. Is it error or is it uncertainty or whatever the scenario? End of life care, palliative management. They are writing what the title of the scenario. So don't worry about that. But from my point of view, 5 years undiagnosed patients, I guess if this is error. If less than 1 year, okay, I agree it's uncertainty because 1 year maybe, yes, similarity in 1 year, but similarity in 5 years is too long to miss the diagnosis. And let's hear the question and comments. Who was asking or who want to ask?
Dr. Basim, as you said, in most of cases or most of the scenarios, they should write where point towards the error. Either they wrote mistakenly or
Yeah, it
by
will be
error.
clear. Yes, yes, I agree with that.
Yes.
I
So this uncertainty.
Yes, it will be clear. Yes, that's why I'm saying, yeah, it's assuring thing. Don't worry, don't stress yourself. The title and the task will be clear. So focus on the title up. By the way, the page is very full of words and sentence. They want you to read all these things in 5 minutes. Try to be fast to read the scenario and to know your position, to know what's your task, to know to whom you are talking, and read the scenario after that. If you didn't read the scenario well, don't worry. You can ask the surrogate, can I know what you have and what do you know about your condition so far and what's your expectation? You will get some of the clues, but please touch Oh. You will the most important to read the test. Okay.
I have one comment regarding
Yes. Yes.
the sick leave, because usually are saying occupational health, and
Mhm.
doctor can give a sick leave. You can give him
Yes,
sick
sure.
leave up to 6 weeks, 8 weeks, 2 months.
Yes.
So there is no occupational health that are giving the sick leave for the patient, the doctor. So this patient
Yes.
will do an operation, so you'll tell him, we'll give you a sick leave, and if you don't want to write the diagnosis and sick leave, we won't write the diagnosis. We'll write that you was admitted in the hospital from this time to this time, and no need to write any details. We can give you the sick leave and stamp it from the hospital and sign it
Yes.
by the. But there
I
is no
agree.
occupational health for the sick leave. Okay, so don't say so. Okay, yes, we can give you sick leave, and and from any time the patient want to take the sick leave, he can take it, even for as a
Yes.
retrograde with the date
Yes.
before. Okay.
I agree with this. The other thing also, the office responsible for the GP problem or complaints is called GP surgery, not PADS.
Yes.
In the hospital PADS, but outside the hospital, the GP surgery.
Yes.
This
So
is
I
also
think
important.
in this question we can say, as Dr. Aisha said, I wasn't there, so I'm not sure about the circumstance. But we can have a talk with the GP. If you don't mind, we can have a discussion with the GP to know exactly what is the cause. If it's confirmed as a delayed diagnosis, I'm sure you have the right to complain, and we can do proper investigation for that. And you can complain, you will go to the GP manager. So the GP manager, he's the one who takes the complaint from the GP, not the pulse. It's called GP manager. So you can do that, and you can skip from this question by saying I wasn't there, so I'm not quite sure. But usually the GP, I've seen common disease, so common causes are common. And I'm not, I don't, I wasn't there about when you have this presentation and what has been done. But if you want us to help you with that, we can call the GP, discuss with him, and to know exactly what is the circumstance. And if it's proven there is a delay in diagnosis, so I think it's your right to raise a complaint.
Yes.
We can make it only like this in a simple way.
Yeah. Apart from saying I wasn't there, better not to say it because it means you are escaping from. But you can
No,
say,
I
yeah,
think you
it's
say
the things are not clear. You can say the details. It's not clear for me. I don't know more about
but
the
if we say
circumstance.
we wasn't there with the I didn't attend what's happened, so I don't know exactly.
Okay. Okay. I didn't hear any comment about any feedback about this sentence, but so far it's okay.
Okay.
Okay. Thank you, Dr. Sarah. Well done.
It's a little harsh, but sometimes the patient is very angry.
Yes.
Yeah, I
Yeah,
mean, so
this
sometimes
is
the
my
patient is very
point.
angry and he's keep
Yeah,
talking
if you
and
will do that,
complaining, and yeah, it depends on your feelings, yes. But you have to say it in a humble way. It's not like in a harsh and aggressive way.
yeah, yeah, be sympathetic. I'm
Any
sorry. Yes, like that. Yes, I agree. But don't like skip from him. No, I wasn't there. I wasn't there, so I can't help you. No, even you will say it. I'm sorry. I can. I wish I could help you in this, but um, I'm afraid to say I wasn't there, so I cannot give you more details about your condition and the circumstances about the complaint that time. Like this, don't be harsh with the patient, or sorry, or the surrogate or the patient, and he's angry. You will get low mark for this. Be sympathetic and try to absorb his anger. Okay? Any other comments? Nice discussion today, very hot discussion and day, and the cases and scenarios as well. Thank you, Dr. Sarah and Dr. Abdullah, Dr. Aisha, and Dr. Abdul. If no more comment, no question, we can end the session. We'll see you tomorrow, inshallah. Good luck and good night. Assalamu alaikum wa rahmatullahi wa barakatuh.